welcome to Alzheimer Speaks Radio. I'm your host, LaVoi, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
I can't wait to introduce you to everybody from Emerald Crest. We're going to have a really great conversation today, and I know you're going to enjoy this. So first, I want to introduce you to Christine Drasher, and she has been Cassia's admissions and marketing director at their Emerald Crest community since 2001. So 20 years. She is using her extensive sales and marketing experience and training there as she has helped hundreds of families find that right fit for the memory care environment for their loved one. Christine is also a task force member for the Hopkins Act on Alzheimer's and the South of the River Friends of Dementia Initiative and the co-developer of memory cafes in Shakopee, Hopkins, and Prior Lake. So welcome, Christine. I'm thrilled to have you with us today.
Hi, Lori. Thank you very much.
Next, I want to introduce you to Jenny LaVoi, and she is the Director of Cognitive Care Program at Emerald Crest. And she is an occupational therapist who's worked over 20 years providing direct care to residents at Emerald Crest by Augustana Care. She is also working as the occupational therapist at the Shakopee community. Jenny is driven to make a difference in the lives of people with dementia-related illnesses, and she knows how often they are overlooked and how important it is for the societal perceptions to change and for people to feel engaged and part of their community. So welcome, Jenny. How are you doing today?
Good.
Wonderful. Well, thanks for being with us. We're going to pull in the other two, and then we will start our conversation. So next, I want to introduce you to Sarah Ziegler. She has been an occupational therapist at Emerald Crest of Burnsville for over 12 years. She works closely with the housing director, nurse, direct caregivers, and families to identify what challenges or gaps the residents are experiencing due to their dementia. And once those are defined, then she works with the team to develop strategies and techniques to fill those gaps so that they can maximize their abilities and level of function. Sarah focuses on cognitive assessments, behavioral management, staff training, and finding opportunities for residents to participate in daily care and meaningful activities to promote success and that self-worth that we all so badly need. So Sarah, thank you for joining us. How are you doing today?
I'm doing well. Thanks, Lori.
Well, great. Thank you for being part of this program. Last but not least, I want to introduce you to Heidi Maes. She's a family member whose loved one lives at Emerald Crest. And she's going to give us her thoughts on Emerald Crest services and how they've impacted both her loved one and her family. So welcome to the show, Heidi. I'm thrilled that you're going to be here representing families. I think that is such an important aspect of the team. So thank you for taking the time. So we're going to start out with Christine. I want you really to talk to us more about Emerald Crest Memory Care in their communities. What differentiates you from others out there?
Yeah, thank you. Well, if you can believe it, Emerald Crest has actually been providing memory care in the Twin Cities for over 20 years. We actually opened our first site in 1998. And I always say, we were one of the first memory cares. we were memory care before memory care was cool. Now everybody has memory care. And so, I think we've always found ourselves to be experts in that because that's all we do is memory care. And I think we do continue to have that label with our communities. We are part of Cassia, a Cassia community, which is not a lot of people necessarily have heard of Cassia, but they probably heard of Augustana Care or Elam, and that is actually an affiliation. Cassia is an affiliation of those two organizations, and that Cassia actually came about in a couple years ago. Emerald Crest has 4 locations. We have one in Burnsville, Shakopee, Minnetonka, and Victoria. And really what makes us different is we were created as an alternative to a nursing home. When we first were built, we really wanted to be a home setting. And so we built houses that are one level, barrier free. There's no elevators, no stairs. The design is very circular. The common space is in the middle and the rooms are on the outside. And the reason we do that is so that we can, the residents can get around very easily and they can safely do more of a wandering circular motion if they need to do that, but also they're in eyesight of our caregivers and we can really involve the residents in our programming because they're easy for us to get out of the room and participate. It's very much a true home setting. Like I said, that one level house, and when you drive up to our communities, you'll see that it looks like a townhouse. We usually have multiple houses on a campus. So for example, Burnsville has 5 houses, Shakopee has 3, and so on. So we have multiple houses on each campus. And we are in a residential area. So it really is like being in your home at our communities. We have 12 units to a house, so it's not too big, not too small. So I think that is very different. You have some of these residential care homes that are 4 or 5 residents, and then you have assisted livings with hundreds of residents. Having that 12 to a house is a really nice number for those with memory loss. We do have the separate buildings, as I mentioned, and I think what really makes us stand out besides our occupational therapy model, which we're going to go into in a little bit more detail, is that we actually stage our houses. So we do different levels of care, and I know Sarah's going to be talking about that a little bit more as we go on here, but we really found that if we can have different stages, different units of the different levels of the residents, it really benefits the residents for socialization. It's really nice that they can have others around them at that same level so they feel very comfortable. The program that we do, which I mean, when I say program, I mean our activities calendar is designed for those levels so that we're really providing what those individuals need, and they're successful with activities. They're getting the engagement they need, but maybe also through that day, they're getting that downtime that they need too because of the level of function that they're at. They may need that. So having these very specialized units for these different levels is really benefiting the residents for where they're at with their cognition. We do change up our staffing ratios a little bit between the houses too, and that's nice as well as an individual's needs become higher physically, we are able to increase that staffing. So our staffing is about a 1-to-6 ratio, and we do have 24-hour supervision, and our caregivers are highly trained on dementia. And Jenny and Sarah, who you're going to hear more from, are very involved as occupational therapists in the training of our staff. And I think by having them included in our training along with nursing, that really gives our caregivers really good practical insight on where our residents are and what their needs are on a daily basis. We, like I said, have 24-hour care. We have nurses on site as well, and they're there Monday through Friday. They're not there on the weekends and overnights. Again, we're an alternative to a nursing home, so we don't have that really high extreme medical needs. So having the nurses just available on call really works well in our environment. Probably the one thing that I spend a lot of time talking to the families when they're looking into memory care is our occupational therapy model, which again, you're going to hear more from Jenny and Sarah on this, but OTs are a huge part of our team at Emerald Crest. They're a big part of our care team. From day one, when we built and developed Emerald Crest, we found that OTs are really the dementia experts. And we really decided this is a time to do something different and invested on having OTs as part of our care team at every Emerald Crest community. And so by doing that, that just really gives us a unique knowledge of a person, those individuals' function and how we can be successful with their cares, with communication, behavior management, all those types of things that those OTs can really give us some insight on. And then lastly, I just feel we are a really good, affordable memory care. I always tell families, I feel we provide a good bang for your buck. When you look at the Twin Cities market, the spectrum of costs, Lori, can be, on the low end, maybe in the $35,000 to $4,000 a month range for not as much care, up to I've seen, up to $15,000 a month, depending on the level of care. And I always like to say we're kind of in the middle. Our average is about $6,800 a month, but you're getting so much with that compared to potentially other settings, just because of our size, our ratio, our OTs being involved. It just really, you're getting a lot for that amount. So we do work with medical assistants. So as our clients do run out of their funds, we do have that as an option for them too. So it's we're here to provide long-term placement for our residents, and we don't want to have that be a reason why they have to leave. So those are all the components that makes Emerald Crest unique.
Well, you really did a very nice job kind of summarizing things. And I don't know if everyone noted this when I was doing introductions, but just the length of time that these 3 employees have even stayed with the company is kind of unheard of out there. And so that makes a really, really big difference in terms of that continuity of care, and is really important, to the mission. And I love how you guys were so far ahead of other communities, because my mom lived with dementia for 30 years and she's been gone, 7 years now already. There wasn't much to choose from at all out there, and having that smaller setting makes a big difference in terms of what can be provided and how it can be provided to people, having it feel like it's more of a neighborhood setting. I think, it just helps overcome a lot of that stigma and stuff associated, with memory care as well. Yes. So thank you. Jenny, I want to go to you next because, Christine had mentioned, the occupational therapists and how important they are to the team there at Emerald Crest. And so, this is something that definitely sets you guys apart from other providers. And you're not the typical rehab style therapist. And so can you explain to myself and our audience here, what does that really mean? What does your role look like and your responsibilities as part of this?
Yeah, when people hear occupational therapy, that's usually what they think of first, is they think of that typical therapist in the hospital or in the transitional care unit, and they're rehabbing, somebody for issues that they're having physically. That's usually the focus. So, you hear a lot about occupational therapists rehabbing somebody that, had a knee replacement or a hip replacement or is recovering from a stroke. That's what most people relate OT to. But here at Emerald Crest, not that we're not focusing on the physical function, but really our focus here is that cognitive functioning. So we're really taking a close look at where are they functioning cognitively and how is that going to affect their day-to-day and how they get about how they are able to be successful in their environment. And so, we're looking at all the different cognitive abilities that they still have, and then also what their needs are. We refer a lot to what's called the wheel of cognition, and a lot of people don't think about what goes into cognitive functioning and all the cognitive skills that we use on a day-to-day basis. And that's really what the OTs are looking at with our residents at Emerald Crest. We're looking at not only what their memory is like, but we're looking at, how many steps of a task can they follow? Are they goal directed? What's their frustration tolerance like? How do they communicate? I mean, you could go on and on all day regarding the different cognitive skills that a person needs to function on a day-to-day basis. And that's really what our OTs are looking at. And when I look specifically at the OTs at Emerald Crest, I really see our time spent in probably 4 major areas. The first one, and probably the most important one that we really focus on, is our assessment process, our staging process. Another area is behavior, communication, different approaches, depending on what stage the dementia, the person is at with their dementia. We're also doing a lot of staff training every day. Our day includes some type of staff training. And then I know Sarah's going to get more into it, but our activity engagement, and the OTs are really involved with staff and training on the different activities. But going back to, the assessment and the staging. So before a person even walks in our door here at Emerald Crest, if we get an assessment request, we're going out there with the nurse to wherever that person is, and we're figuring out where that person is. Are they in that early, middle, or late stage of dementia? And how we figure that out, we use what's called the Allen's cognitive levels. And a lot of people haven't heard of those before. It's a 6-point cognitive scale that's used. It's OT specific. A 6 is somebody that is completely independent, no diagnosis of dementia or any kind of cognitive impairment. And then it goes all the way down to, say, a 2, which is late stage dementia. 1 is a person in end stage dementia. So at Emerald Crest, we are servicing those folks that are in the middle to late stages of dementia. So those are going to be people that when we test them or assess them, they're scoring anywhere from a mid 4, high 4, all the way down to level 2s, late stage. And then we have people that have been with us through end of life, and they're dipping into the level 1s end stage. So we're using that Allen scale when we go out and assess that person to really figure out where they're functioning in early, middle, or late. And so that really helps us then, before they come through the door, to chat with our team, chat with our nurses, our directors, our caregivers, as far as, okay, this person is coming in, they're at middle stage of dementia. This is where they would best fit on our campus. This is where their needs would best be met. And then it also guides us on how do we care? What level of assistance do we have to give them? How do we have to communicate with them? How do we approach them? Knowing that stage can really tell us a lot. And I won't go into a lot of detail because I know Sarah's going to be talking about it, but then we have the different stage houses that I think Christine briefly talked about, where it's broken up into a high middle house, a middle house, and a late stage house. So again, by the OTs kind of completing that Allen cognitive level screen or test, they're able to figure out exactly where that person is in their dementia, where they're going to best fit on the campus before they even walk in the door. So that's a huge part. And then as that person, once that person moves in, we're continually assessing and reassessing that person along with the nurses to see, are they remaining kind of stable with where they're at in their dementia? Are they progressing? And do we need to adjust their service plan so that the staff are providing the right kind of assistance. Okay, so mostly that assessment and staging, that's probably the main area that we spend a lot of our time in. Also behaviors and communication I touched on. So we know that people with dementia, you're going to run into behaviors. There's no way around that. And with some people, they might just be pleasantly confused and not a lot of behaviors to have to try to manage. And then there's other people where their behaviors can be quite intense or frequent at times, whether it's being, verbally resistive to cares or physically combative or wandering or trying to leave the building. I mean, you see it all. And the OTs have they spend a lot of time in that area working side by side with the caregivers to figure out what interventions, what approaches can we use so that we can be successful. The example I always give is you have somebody that is resistant to taking a shower. We see that a lot when it comes to dementia care. And so the OTs a lot of times are going in and they're trialing different approaches, different ways to encourage the shower or get them to be more receptive and cooperative with it. And then it's demoing that and helping the caregivers to be able to use that same approach and be successful. So it's a lot of that, a lot of working on different behaviors. And with that kind of communication kind of goes hand in hand with that. Depending on what stage of dementia they're at, you have to use different communication techniques to be successful with them. It might be more verbal, or as they get into the later stages, it's maybe not as much verbal communication because they can't understand those words anymore, but it's more nonverbal. So it's using, come with me or visual demonstration or holding their hands. So we're doing a lot with behaviors and communication and teaching different approaches. And staff training, I said that was another area that kind of goes hand in hand with that. So, when we're working on behaviors, we're training the staff on approaches. When we're working on communication, we're demoing the right type of communication to use with that person, depending on the stage of dementia they're at. I find that the OTs a lot of times will do a lot of staff training with different disciplines. A lot of times we have like other therapists, physical therapists that come in and are working with our residents. And I find that some of them aren't fully knowledgeable or educated on the different levels of dementia. And, I've had physical therapists before that they're working with somebody that's late middle stage going into late stage and they want to try a walker with the person. Well, if the person's never used a walker before, they're not going to know how to use it no matter how much you try to cue them, and it can be more of a safety issue than a help. So I find that the OTs are jumping in a lot to kind of educate those people, those other disciplines and professionals too that we're working alongside. So it's not just always our staff members, but also the different disciplines and family members. A lot of education with family members, because just like our residents going through the changes our family members are having to deal with coping and going along and seeing all these changes that are happening with their loved ones. And a lot of times that can be really hard for our family members. So it's educating them too on exactly where their loved one is at and what that means for what abilities and needs that they have. So I see staff training and just training in general is huge. And then last but not least, activity engagement. And again, I know Sarah's going to talk a lot about that, but as Christine had said, we have 3 different staged houses, and with each staged house, we have a specific activity program that goes with that house, and the program is based on where that stage of dementia is and what abilities they have as far as activities. So, the length of time that they can attend to an activity, the number of steps they can do in an activity, the whole schedule is really geared for that stage that they're at. And so the OTs are doing a lot of, again, educating staff members on how to lead those activities, because it's our direct care staff that lead the activities. So we do a lot of training before they even walk in the door on the different programs and how to do the activities, and then ongoing training and, making changes when we need to, updating things with the program. It's a lot of that too. So activity engagement. So again, those 4 areas: assessment, staging, behavior, communication approaches, staff training, and activity engagement. That's really what we focus our time on and kind of sets us apart as being very unique when it comes to OT.
I like that you defined, that, because I think most of us, when we think of OT, we're thinking of repetitive exercises, and it's this routine, and you're going to get better and you're going to be released and go back home and all of those types of things. And so you made it really, really clear in terms of what you do. When you were talking about showering, it made me think back when my mom really struggled with showers. And I remember asking Teepa Snow, because she never used to have a problem, then all of a sudden it was just screaming and throwing fits. And I mean, she was just terrified. And Teepa said everything has changed. She's lost her fat pads on her back, so her nerves are, towards the skin more. And so when that shower hits her, it actually hurts. And using a rain shower head will help, starting with the warmer water from the feet up instead of, we start at the top. I mean, all of those things are just so minute and little things that we can change really easily. But when you don't know them, I mean, they're horrible and everybody feels bad and stuff. So having that extra support there to be able to guide staff and even explain to family, what's going on and what's happening. As a daughter, I guess I just find really, really comforting. And when you were talking about communication, it made me think too, as the disease progressed, the importance of using kind of multisensory engagement. With my mom, it allowed her to grab a hold of different things at different times and just made it easier for her to maybe remember who I am, which I know is a big worry with family, and, helping them ended up focusing on, it's not, do they know your name? It's, do they feel safe with you? Are they comfortable? Those are some of the key things. So I think having that staff training available in just an everyday kind of regular piece there is just so valid. So thank you very much for sharing that, Jenny. Sarah, I'm going to go to you next, and I want to know a little bit more about the stages of your houses and how they're determined and what are the differences between them, and then also how you deal with your residents as their needs switch as they progress. Do they have to switch locations then?
Sure, Lori, I'd be happy to talk about the characteristics of each stage and kind of how they differentiate from one another. Jenny did a really nice job of highlighting the fact that we do stage our residents in houses. And so I'll just dive into what those different stages look like. She had said we admit folks in that middle stage of dementia all the way to the late stages. So our highest level home at Emerald Crest is our early middle stage house. Those residents, I'll just highlight some of the strengths of our residents at each of these levels. So our strengths of people in the early middle stage are that they are still able to socialize. They're still able to converse, reminisce about things, able to engage in cognitive games, trivia, things like that. Still pretty, for the most part, physically capable of engaging in things. So we, with our activity program, we try to emphasize those things that they're most successful at. So we incorporate opportunities for socialization in our program. We incorporate reminiscing groups where they can remember those things from their past. Our short-term memory, even with our early middle stage folks, is poor, but they can remember growing up and sharing stories about the work they did, the hobbies they had. And then the really exciting part is that they feed off of one another. The other day I was in one of the houses and one of the ladies was talking about where she used to work, and the other gal was significantly older than her. And she said, I worked there too. And they were talking about things that have changed, and they're able to do that. And so that's really exciting to see that, there's still that spark inside of them to do those things and to engage that way. So we focus a lot on what they can do still at that middle stage that revolves around more socialization and reminiscing and using those cognitive skills. Trivia, we do a lot of trivia. We do one of the games we do is called Complete the Phrase. And I was actually in a room with a resident just finishing up a virtual visit with her, and they were doing that Complete the Phrase out in the common area. And she heard the caregiver leading the group, and the caregiver says a penny for your, and the resident inside her room says thoughts. And I just, there's just that connection there that they're still able to make. And so that's what we highlight in our activity program, is what those strengths are with people in that early stage. And that's all about the communication part of it and the socialization part. As people change, as they decline a little bit more and move more into that middle stage, you're going to see them starting to have challenges finding the words and communicating, and sometimes even remembering some of those things from the past. And so we don't focus our program as much on that in our middle stage house, because you ask somebody about their past and they get embarrassed because they can't remember, or they get emotional because they can't remember. And so you don't want to pull that part of them out. But what they can do well is active things. They can do things. They can participate in exercise, in games. Balloon volleyball is a game we have in our activity program on regular rotation, but even things like, just shooting hoops with a tabletop basketball, things like that, that just use more of those gross motor skills and things that they're familiar with, things that they've used to do. Music is something that really sticks with all levels of dementia, but especially in this middle stage, really resonates with them. Remember the songs, they tap to the music, they sing along with things. So we try to do stuff like that with music. But one of the biggest things too is utilizing props, having things for the residents to look at, to hold on to use, because the doing makes a lot more sense to them. So we focus on the doing and the things that are highly, highly familiar. And we keep our residence day very, very structured in our middle stage. We certainly provide that routine and structure for all of our levels, but in the middle stage, that structure is hugely important, because these are your folks that, you've probably heard it, these are your folks that, what do I do now? Where do I go? So for family members, especially, I think, that still have their loved ones at home, these are the most challenging folks, because they don't always know what to do with their loved ones. So we have a very structured middle stage program for our residents, so that they aren't asking those questions as much. These are also your residents. When Jenny talked about behaviors, one of the behaviors that we see a lot is rummaging in a person's room. Why do people rummage? That's the question we ask about behaviors a lot. Why are they doing what they're doing? They rummage because they're looking for something to do. And so we try to eliminate the reason for them to look for something to do by keeping our program structured in that middle stage home. As somebody changes and moves towards that end stage of disease, they're starting to struggle more with the programming. They're needing more help with their care in all sorts of different ways. So when somebody is needing more assistance, they're not participating as much, they move to our end stage home where they still have strengths. And those strengths that they have are more sensory based. They still can see the world around them. They can hear what's going on around them. They enjoy eating. We focus a lot on having delicious food for them. Sweet is a sensation that people taste all the way to the end. And so we do a lot of sweet treats with our residents in our late stage house. We focus on touch and engaging with things one-on-one. Hand massages, we do a lot of sensory-based things, or recommend that to family members, especially when they come to visit. What do I do? What do I do with my loved one? They're in the late stage and I don't know anymore. Sit there and hold their hand. Give them a hand massage with lotion. Rub their back. Put some music on and listen to it together. All of those things engage those senses. And one of the biggest things we always remind people of is that when somebody is in the late stage of dementia, they still can sense what's going on around them. They can also sense the people around them. I think, Laura, you had mentioned it about your mom. She knows that she doesn't maybe know your name she didn't maybe know your name anymore, but she knew you were a calming presence. And so we always educate that even at this later stage, and they're not doing as much, they still can feel that emotion that's in a visit or in an activity. Things that we focus on, Jenny mentioned this, is attention span in each of these levels. In our late stage, with our late stage residents, our attention span is very short. We keep our group length at 15 minutes. Typically, somebody's attention span is 5 to 15 minutes at that late to end stage. So we're trying to capture their alertness during those small windows of time. And then Christine, back when she started talking, she talked about the balance of activity and rest. It is so important for all our folks at each stage to have a balance of activity and rest, but especially in that late stage, we focus on giving extended rest times. People wear out a lot more quickly in that late stage of dementia. So they need more opportunities to rest and get quality rest and reposition. And one of our biggest goals we say in our late stage home is to provide comfort. So those are our primary focuses in each of those 3 staged houses that we have. You asked Lori about how we know when it's time for somebody to transition and how we go about that, moving them, through those stages kind of seamlessly. And I would say, we have been able to transition people from stage to stage, house to house pretty seamlessly because we're looking for signs that they're changing. We look for signs that they're not participating in the activities like they used to. They're maybe isolating from things. They're not getting along with their peers. They're having behaviors that are not typical for them. That might mean that they're struggling. They're not getting what they need in the home that they're in. And so that helps us to know when to transition, but it also helps us to transition them because they are needing more of that care, different types of care. So when we transition somebody from house to house, they're usually ready. The beauty of our houses at Emerald Crest is they all look the same. The setup, the layout is the same. So the residents don't often know a big difference in the environment because it doesn't look a lot different. The people, the faces are different. But what they are getting from the people in that setting is the right amount of care and engagement. And so that usually makes the transition quite smooth, moving our folks from house to house. And it's really warming to see somebody settle into that place where they do belong. So I think with the knowledge that OTs bring to all of the different characteristics of the levels, we're able to seamlessly help them transition from house to house, educating the staff on that, and helping the families kind of deal with those changes in that transition. So just those are the things that we're able to offer with our specialized program.
Wonderful. I have a couple of questions for you.
Sure.
One is when you talk about moving from house to house, because these terms are used differently in different communities. So when they're moving from house to house, is that house in a different city, or do you have these different levels within one community? Just so the audience is clarified on that.
We are able to accommodate all 3 of our stages in one community. So Christine was saying that the different Emerald Crest, we have different numbers of houses on each campus. So 5 houses, 3 houses. On one of our campuses, we have 2. So the stages are kind of smushed up together, split up a little bit differently. But we are able to transition people through the stages on that same exact campus. So they're not having to travel very far except down a sidewalk through another front door.
Wonderful. That is really helpful. And I just wanted to make sure that we were clear on that with everybody, because I know that can be a real tough thing if people have to switch not just physical locations, but companies that they're dealing with as a whole, or switching cities and stuff. I love how you talked about working in their attention span and understanding it's 5 to 15 minutes, that need for engagement and for rest. I remember my mom, even with music engagement, she'd be there and then all of a sudden, she was out, and then she'd come right back, 10 minutes later again, and she was right there. And, it was just what her body needed, and she was listening to it and following that. I also loved when you talked about using kind of that multi-sensory thing and doing the hand massages. To me, that was so important. I mean, I never went to go see my mom without a bottle of lotion, because it was just something simple that I could do. My daughter never went to visit grandma without nail polish, because that was something that she really liked to do and that grandma really liked. And my brothers weren't so touchy-feely, but, we got a CD player in her room and they could push a button and put on Frank Sinatra and just let her be peaceful in that. And so I think those are all, great things that, in terms of what you do. And I have to say, I adore the passion in all three of you guys. That is not something we always see with staff when they're talking about things. Sometimes it can be, this is my job, and they're saying all the same things, but they're saying it differently. And you can just see you guys beaming when you're talking about this, that you enjoy this and understanding this is really important work. So next, I really want to go and talk with Heidi now and hear the family side of this. So Heidi, if you can share with us a little bit about your journey with dementia and what brought you to Emerald Crest.
Well, I think my mom we started to notice in about, 7 years ago, her language got a little wonky and she'd repeat herself. She was an English teacher and a librarian, so she was reading books all the time, and she couldn't quite tell us what she was doing anymore. And it started to progress, and she's been married to my dad for 55 years now, but 2 years ago, it just got to be too much for Dad. And we maybe didn't quite know what was actually going on, but she came to live with us for probably about 6 months. And she loves to walk. So we did a lot of walking, and it was great for all of us. And then she went back, and they're living in Sioux Falls, South Dakota. And she started going to an adult daycare. So that gave my dad some time. And then it just progressed, and she had to go into the hospital and over New Year's. And then Jenny came to see me in the hospital, and that was that. And so my mom has been at Emerald Crest since January 2020. And I love it. I love it because she loves it. And when they were talking about, they look like little townhouses. When we drove up that day, I was so nervous that she was moving in, and she thought it was just beautiful, and this is for me. And she was thrilled, and she walked in like it was her house. So the transition for us was fabulous because she was happy from the get-go. And everything about it, now that I've gone through it, if somebody would need some help, I would say, oh, you need to look for a place that has these transitions, because now I realize how important that is. So that's just a little bit how we got there, and thankful, just so thankful. And the staff is all fabulous, and she's just always happy except for that shower. So the shower is tricky, and I don't know if she's ever going to get through that. But when she's done, I think she does say thank you when it's over. But we love it there, and she loves it. And in fact, our pictures are all over the entire house because she's decorating, and she really thinks it's her house for sure. That's how we got there.
Wow, that is just a fun story. And I think for any families listening to this, I'm sure they're just breathing a sigh of relief, because this is such a complicated and difficult process to go through. This is not anything anybody wants to do. Many families have made comments saying, we're not going to place you. You can live at home forever, not realizing that things change and needs change, not just the rest of the family, but theirs. And I think that's where the guilt really comes in from family members, is feeling, I'm exhausted, I'm burnt out, I can't do this. Everyone's telling me I'm supposed to be able to do this, but to find that placement, I know for myself, being able to walk in and see your loved one comfortable and engaged is a tremendous gift and a relief. I mean, I remember walking in, my mom ended up having to go to a nursing home, and actually she wanted to go because my dad was there. In a moment of clarity said, you know, she's not going to leave him after 49 and a half years, which is a very unusual story. I know most people, that's not how it works. They don't pick to make this move. But I'll never forget the day that I walked in, and there was the life enrichment or activities person sitting there with, it was like an Oprah magazine that opened up for 4 pages. And the 4 pages, all it was a big floral garden with all these beautiful, brilliant colors. And then sitting in a horseshoe around them was exactly what you guys had described, of the engagement and the reminiscing. And some were talking about their gardens, and some were just talking about the flowers and the colors. And I mean, the conversation just went all over. And I remember standing in that doorway thinking, I couldn't give her that, because she's part of a peer group again. And that is so critically important. And it just, anyways, it did for me, Heidi. I don't know if this did this for you, but it just made my heart melt that she belonged, that she fit in, that she was part of a community again.
Oh, yeah, 100%, to see her just so enjoy herself, and just feel so successful. Even living with us, I have 3 kids who are in and out and in and out. And I think I didn't know this at the time. I do now, but that was overwhelming for her, for sure. And it was great to have her here for that amount of time. But finally in the hospital is when the doctor said, you can't take care of her anymore. And that was hard to hear, but I was thankful that somebody besides, my brother or said it. So I knew it was time to go. And I think she was thankful, really thankful, especially when she went to her room and it had the little name tag and it said Linda, and she just couldn't believe it was all for her. So that just, you just feel so good that she probably was thinking in her head, I can't tell you what she was thinking, but she might have been thinking, finally, you got me to the right place. So, it does feel good.
Wonderful. Well, thank you for sharing that with us. That's just such an important piece of all of this, is getting everybody on board and getting them all to feel comfortable. And, when you've got trained staff, and not that they're just trained, but that they really care, which you can sense from all 3 of these ladies, and you can tell just from how they're talking, they want the staff there to learn on a daily basis how to be their very best, and how people there can live their very best life. To me, as a daughter, I mean, there's nothing more valuable than that. I mean, it allows you to sleep at night, and relieves so much of that stress, and then allows you, if you're a husband or wife or a son or a daughter, to get back to being that with your loved one, and not carrying that additional burden of, and I hate even using that word burden because we do it out of love, but it does drain us. It's another pull, and it pulls us sometimes away from being who we once were together. And to me, that's a huge gift to both sides, to be able to just, have the relationship back. And I know as a daughter, I lost that because I was so busy being task oriented, doing all those things. I gave those small moments of sitting quietly or holding her hand or whatever it was. I gave those up because I was busy being busy. And when you get those back, to be able to just sit next to them even if there's no words said. I mean, sometimes that's the safest place you can be, and they can still give that back to you as you can give that to them. So kudos to the group here, and Heidi, thank you for sharing. Christine, I want to wrap up as we enter discussion here, and ask you if you can share with us how someone can learn more about Emerald Crest, and how can they connect and discuss, the move-in process, and what is that really like, and how does that go?
Sure, absolutely. Well, a lot of families will start to connect with us via phone. So there's two individuals you talk to, either myself or Liz Wendell. Both of us work in admissions, and that's a really good place to start, is to start talking to us about, what does your loved one need? What are you looking for? Are we a good fit? What's availability? We just kind of really start just getting to know your situation better, and help guiding you. And that's really what our job is to help guide you. So Liz's, the main intake number is on our website. It is 952-908-2215, and that goes directly to Liz. If Liz doesn't answer, then I also help with that. But you can also get her email on our website at emeraldcrest.com. After talking on the phone, if the family wants to actually come in and see it, we offer tours. We can do it either virtually. We've done a lot of virtual tours lately, and we also do them in person at this point. So we're happy to do that. That's a really good time. We can sit down with the family. We can show you what we have, the different stages. We do like to walk you through that, get a sense of what those houses are like, show you the rooms that we have. That's just kind of the next step. And then from there, if you want to move forward, we pass you on to Jenny and the nursing team to do an assessment, and then it's pretty seamless after that. So we would Liz and I just walk you through that process. We want you to feel like you have somebody who can guide you through that whole process.
I wanted to see if anybody else had any other comments that they wanted to throw out, maybe something that we missed. I think, Christine, you had mentioned something in the chat box that I had missed that you wanted to add. Do you remember what that was?
Yeah, you actually didn't miss, and Jenny didn't miss either. I just wanted to add, that when she started talking about the differences of the clinical kind of more rehab OT and what we provide, I think individuals really understand that, when you go through an acute need with an OT, you're driven by insurance, right? Your insurance provides the cost, covers it. Your insurance will tell, how long they're going to work with that individual. And then usually when that need is done, that OT is done. They don't really follow them long term. What's really neat with us is our OTs, they are with them through their whole journey at Emerald Crest, from move-in day to discharge. Even sometimes we help families even further than that. But they're there that whole time. So they really get to know that resident well, and knows, when there is a change that they need to really start looking at some changes in their care plan, or possibly a different house. So I wanted to kind of throw that in there. And then the other thing I wanted to throw in is, as Sarah was talking about our program, I always like to say, our activity schedule or daily program is more of is more of a treatment for their dementia symptoms. Not necessarily, we don't just do it just to do activities. We do it because we're actually wanting to reduce some of those symptoms that come along with dementia, those behaviors, those types of things. So we kind of view it as more of a treatment. And we have the same schedule 7 days a week in each of the houses. And so that, just keeping that routine of the day and structure is really important, and really helps our residents to be able to get, have a really structured day and be engaged, and then sleep really good at night. So it really keeps that internal clock on sync for them too. So it's really a treatment for them. So I just like to throw those two things out there.
Question. So I'm just going to throw this out, because a lot of families struggle with sundowning and people having issues. Do you do certain types of things during that sundown period to help people stay calm and engaged?
I can comment it, and if anybody else wants to add, they can. Yeah, you bring up a good point. So, sundowning, a lot of people have heard of that term. That's usually, if a person's going to have that, you usually see that in the late afternoon or early evening. And really, it's a time of increased confusion, agitation, anxiety, that type of thing. That's when you're going to have people maybe pacing, wandering the house saying, I got to go home. Where are my parents? I need to get to my kids. That kind of thing is, you see that. So in our schedules, a lot of other memory cares you go to or assisted livings, a lot of times, they eat lunch and then you go and immediately, it's time to take a nap. That's what you see a lot at a lot of other places. And then when they're actually waking up, they're waking up right at that late afternoon or right at that dinner time when that sundowning is hitting. So now they've been napping, they wake up, they're disoriented, and boom, there you are, you're in sundowning time. And then a lot of times you see that sundowning or those symptoms of sundowning even worse. With our programming, we follow a kind of a certain rhythm. It's you get up in the morning, you eat, you have activity, you rest. You eat, activity, rest. So it's kind of a cycle. And so after lunch, we're not saying go back to your rooms and take a nap. Right after lunch, about 1 o'clock, they're starting right up with activities pretty much the whole afternoon until about that 3 o'clock time. And then at that 3 o'clock time, we're kind of going then into a rest time at that sundowning. So we're kind of like bringing the level down in the houses, trying to create kind of a relaxed, calm environment, whether it's with relaxation videos or music, whether it's with hand massages, whether it's with lavender oil. But we're purposely timing it at that point in the schedule to kind of head off any of that sundowning that might occur. So I don't know if anybody else has anything to add, but that's kind of how I see us, dealing with that.
Wonderful. I think this has just been a brilliant conversation. And, I wish my mom was still alive to be able to be cared for the way you guys care for your residents. And then also supporting the families as well. How cool. I mean, it's just so, I still can't believe how ahead of the times you guys were with this concept to begin with, but how it's really evolved, over time as well. And the consistency in terms of what you provide care and how and the whys being understood. I think a lot of times that's where things can fall down, is people don't know why they're supposed to do it this way. And when you understand that, it makes sense. Having it be repeatable, where then the next staff can share it with somebody else as well. So you can always go to their website, www.emeraldcrest.com. Again, that's emeraldcrest.com. Or you can call and talk with them via the phone at 952-908-2215. Thank you so much, everyone. And I hope that you like and click and share this when you're listening. This is important information for families to hear. I think it'll calm their souls and give them hope that making a move doesn't have to be so difficult, and you don't have to carry that burden of guilt when you know how well they're being cared for. So check out Emerald Crest, everyone. Thank you.
Thank you.
Thank you.
Thank you.
Hey everybody, Jared Sebesti here, host of Retire Repurposed. This podcast is dedicated to help people transition into fulfilling and purposeful retirements. Retirement is a big life change. In fact, the two most dangerous years of a person's life are the year they were born and the year they retire. Few people could just flip the switch from working a career 30 or 40 plus years, retiring on Friday, without methodical steps to living what we call a repurposed retirement. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.